Beyond the impact of COVID, hospitals are facing a national shortage of a supply for a potentially life-saving kidney treatment.
Tonight, our Nicole Grigg meets doctors having to make tough decisions on who gets it and the impact it has on families.
This memo was sent last week by Banner University Medical Center's chief medical officer, identifying that CRRT restrictions would begin this week, and that twice a week, a system CRRT work group will meet to review any patient who has been on the device for more than 5 days, or if they meet exclusion criteria. That team will then make a determination if the patient can remain on CRRT, deciding who has the best shot of recovery. Once the decisions are made, a patient's doctor and a critical care team will have an hour to appeal it.
They are the most sick, the critically ill ones.
Dr. Jean Roby, a local nephrologist, says doctors have to weigh if CRRT will even be effective for a patient.
The atmosphere right now in the hospital is one of desperation, meaning we want to do the most we can, the best we can, and we have to make choices like we always have that will give us the best outcomes in a meaningful way. And so we are in the habit of adding things to support things to buy time.
Banner Health telling us that they're experiencing limited staff and supplies, writing a CRRT oversight program was put in place so that we can continue to offer this therapy for those in whom it will make a significant difference.
This is taking an emotional toll on doctors too. An anonymous doctor who I spoke with said they cried when they got that letter telling me that it broke their heart.
Raymond's kidneys don't function at all.
Raymond Scott, with his wife by his side, share how he's been on dialysis for 2 decades. Him and his wife and their nonprofit 1 in 9 help other patients with kidney failure. He's been in the ICUs for treatment before, but never had to be on CRRT machines.
And so then how do they pick and choose who gets that therapy and who doesn't? I'm glad we wouldn't have to be in that position to make that decision.
The memo adding that discontinuation of the devices will be quite rare, and a spokesperson telling us that this CRRT program does not reduce or eliminate care for other renal patients. In Phoenix, Nicole Grigg, ABC 15, Arizona.